Everybody. Well, happy National Infertility Awareness Week. We've had a whole week of exciting things. I don't know if you guys have been watching the or listening to the Beat Infertility Virtual Summit. That has been a pretty amazing opportunity. A lot of my patients have given me amazing feedback. I did 2 of the lectures as well as my partners, Dr. Euler and Dr. Hirschfeld. So that was amazing. And we've had a whole bunch of different activities this week. Yesterday, we all wore orange. If you don't follow me on social media, you should, because I'm pretty fun sometimes. Maren, it says that there's somebody in the waiting room.
Yeah, I got it's so
okay. I don't know if you need to let them in or not. Sorry. Our virtual waiting room. Okay, so we're going to talk today. It shouldn't take too long, but 10 ways to boost your fertility naturally. Obviously, most of our patients are in a break, although we're about ready to get started with doing treatment again. So hopefully everyone will be able to get started doing treatment again really soon. But these are sort of 10 things you can do to sort of get your body as ready as possible so that when the time comes that we're able to move forward for you, then we are able to rock and roll, and that you'll have used this time productively, and that you'll have sort of the best prognosis possible. All right, so the first thing is you need to figure out when you're ovulating. So you need to listen to your body for signs of ovulation. So what are signs of ovulation? So one really easy way is to do urine testing for ovulation predicting. Sorry, I gotta get some water here. Ovulation predictor kits look for something called LH in the urine. Now, the brand I like personally is called Clear Blue. I like the Clear Blue, not the Clear Blue Advanced, although I actually had patients tell me they had a hard time finding the not advanced one, because the advanced one looks at both estradiol and LH in the urine. And let me just see if I can show you all a picture on my little screen. Give me 1 second here. I'm going to show you all a picture. So I don't know, guys, if you can see my little screen here, but the green hormone here is LH, and the pink hormone here is estradiol. And what can happen is sometimes they can catch it like here, where the estradiol is high, but the LH isn't high yet. And so I personally think that there can be a lot of confusion with the advanced LH, the advanced kits. So I like the regular ones. But you can look for changes in cervical mucus, usually around the time of ovulation. Your estrogen is really high and cervical mucus becomes kind of more like egg whites. You can also feel for ovulation cramps. Medically, we call these middle schmerz. Usually it's on one side or the other. And then breast tenderness is a hard one because that usually happens after you've already ovulated. So it's not really a good predictor of when you're going to ovulate. That's why I like the ovulation predictor kits, because usually when the test turns positive, and I do like the ones that have a smiley face, so you're not having to read multiple lines, you can then really look at, have intercourse the day of that smiley face and the day after, okay? So obviously, eating as much organic food as possible is always a good idea. Given our current circumstances, some foods are pretty limited right now. Some foods are not available right now. So, in terms of grains, whole grains, fresh fruits and vegetables, and meats, trying to eat as much organic as you can to try to limit any processed foods. I'm actually working with a dietitian right now, to come up with a nutrition program for people trying to get pregnant. So that's in the works with all this extra time I've had lately. So be on the lookout for that. It's a 12-week program for both men and women. And right now we have like 9 out of 12 weeks already put together. So, and I'm working with a dietitian to make sure everything's good for pregnancy and everything like that. So some exciting stuff in the works. Okay. Exercise and yoga, always important to keep your body moving and flowing. Obviously, exercise helps maintain weight, also helps keep your cardiovascular. Pregnancy is a stress on the body, and so having good cardiovascular is really, endurance is really important for pregnancy. Also, yoga has been shown to increase blood flow to the pelvis and increase our mood and our ability to sort of tolerate stress. I will tell you, so I have a Peloton membership, and you don't need a bike to have a membership for that. And they have lots of yoga. Actually, my favorite yoga that I do at home is on just YouTube. There's this woman, she's like amazingly beautiful and so calming. Her name is, they call it Boho Beautiful. It's like her and her husband travel the world and do yoga in the most amazing places. It must be a nice life with their dog. But it's just like incredibly calming. And there's different kinds of yoga, right? There's like yoga flow, and then there's like yoga that you can do right before bed. I also really like meditating. There's a couple of apps that meditating clearly is an exercise. So maybe we'll get there a little bit later, but there's a couple of apps that you can use to help with that kind of stuff. But I really like
this guy is
yoga,
like sitting in the middle of me,
as well as
so
cardiovascular exercise plus yoga. Obviously when we're doing stimulation with fertility meds, we don't want people doing a lot of high intensity exercise. And so, during stims, you want to sort of keep to low intensity exercise, things without a lot of bouncing. So like walking or stationary bike. So those are some things that you can do. Maintaining a normal weight. I think everyone is under a lot of stress, and there's a lot of memes going around about the quarantine 15 and everything else. So, I would encourage you to just try to, just stay in a healthy weight so that as soon as we're able to get back to treatment, and as you are trying on your own at home, being underweight, which can also happen with stress, or being overweight are things that can decrease your chances of being successful. And often having too much or too little fat disrupts the sort of signals from your your hypothalamus in your brain, talks to your pituitary, that then has to talk to your ovary. So the signals between your brain and your ovary are in a really delicate balance, and stress, including extra weight or missing weight, can cause disruption to that. So we know smoking, both nicotine or marijuana, as well as secondhand smoke. I think that I've heard a lot of my patients who are have trouble with addiction to nicotine are using this time to try to quit. They're like, they don't want to have to be going to the store all the time. They don't necessarily, want to spend the money on it right now. I think that using this time to stop smoking is an amazing, not even just smoking, but using nicotine, because I have a lot of patients who say they don't smoke, but they vape or they use gum or whatever, right? But nicotine itself has been shown to decrease pregnancy rates in half. I also did a podcast on marijuana, both on the Beat Infertility podcast, and I just did one this week on the Cade Foundation. It was on 4/20/20. Isn't that funny? 4/20. About the effects that marijuana, THC, and CBD have on pregnancy. And so maybe we can put a link to that as well. But because I know they said they were going to keep it up on their website. So if you're somebody who uses recreational nicotine or marijuana, I would definitely recommend you stop. It does decrease your chances in half of getting pregnant. It does increase risks of ectopic pregnancy as well as cervical cancer. And it's expensive. We want you to save your money so you can spend it on diapers. Alcohol, another meme going around, maybe not just a meme. Everyone's like stuck in the house with nothing to do but drink. Nobody's driving anywhere. So the recommendations for women is no more than 2 alcoholic equivalents in a 24-hour period, none after ovulation. So an alcoholic equivalent is 12-ounce can of beer, a 1 to 1.5 ounce shot of liquor. So like if you think about the martinis, or they put a shot of this and a shot of this and a shot of this, it's 3 alcoholic equivalents, right? So one shot is considered an equivalent, or a 5 to 6 ounce glass of wine. So it's important to sort of, and then that's for women, and for men, it goes up to 3 in a 24-hour period. So I certainly would recommend, not boozing as much as, you may want to, given the circumstances, to prepare your body. There's definitely some good evidence that alcohol decreases chances of pregnancy. Caffeine. One of my favorite friends. I did not start drinking caffeine until I was pregnant with my 3rd child. After going through medical school and not needing it, and residency and fellowship and becoming an attending doctor. It was not until much later that I needed caffeine, but now I do love it a lot. Recommendation is to stay under 300 milligrams a day. An average 8-ounce cup of coffee, 8 ounce. So, venti is about 20, right? So an 8-ounce cup of coffee, like the one you would make at home, in a regular size mug, not a crazy huge mug like the rest of a lot of us drink, is about 100 milligrams of caffeine. And the, tea is approximately a little bit less, about the same. A can of soda is about 50 milligrams. So I tend to get a lot of my caffeine from chocolate as well. Dark chocolate especially has a lot of caffeine in it. So just be cognizant of how much caffeine you're consuming. I usually recommend people try to stay under 20 ounces a day. And if you want to drink something warm, either switch to decaf after your 20 ounces of caffeinated, or you could do 40 ounces of half calf. So folic acid and prenatal vitamins, obviously anybody who is reproductive age should be on folic acid and prenatal vitamins. And the prenatal vitamins have some good iron in it, which most of us aren't getting enough iron from our diet. And when you are pregnant, you need to have a full tank of blood supply to help, oxygenate your baby. I think that we know that folic acid decreases chances of birth defects, including neural tube defects. So I think that it's important to know that everyone should be taking folic acid along. I personally like the prescription prenatals that have a little bit more folic acid and advanced iron, which is easily absorbed and does not cause the kind of constipation that some of the over-the-counter products can cause. So, but really any prenatal vitamin is better than none, and anything with, make sure you get enough folic acid. You can definitely look for up folic acid. If, for example, a lot of things are fortified with folic acid, so breads and cereals and that kind of thing, but it's really important to make sure that you're taking your vitamin. And if I had a problem when I was taking prenatal vitamins where there was a lot that I didn't tolerate well. They would just make me, nauseated or not feel well, or, so now before I recommend a prenatal to a patient, I always make sure to take it myself to make sure that it's easily tolerated. And, you can always take it with food, and there's a lot of prenatals out there. If you're not tolerating one, there's lots of other ones we can try. And a lot of the prescription ones are like real small and, don't have a ton in it. The one thing that they have a lot of the important stuff, a lot of them don't have enough calcium in it as well. So that's something you definitely want to make sure you're either getting from your diet or a supplement. Okay, so let's get back to meditation. Being mindful and doing meditation. A lot of people obviously aren't doing acupuncture right this moment because obviously of social distancing and stuff like that. But meditation is an amazing ability, and there's some evidence that people who meditate and are grateful for things and spend a lot of time on mindfulness actually change the brain patterns, change the neural systems in the brain. And patients will feel better who are doing this. It helps them avoid having a lot of discomfort during treatment, as well as sort of during stressful times. It helps you be grateful for what you have and sort of rest your mind, learn how, it teaches you sort of how to rest your mind. And when I thought about meditating, I thought about like people and yoga and stuff. I thought about people like sitting, crisscross applesauce, with their hands out, doing, and that's not what we're talking about here. So in terms of yoga, it's a lot of sort of stretching and movements to sort of increase blood flow to your body. In terms of meditation, there's a lot of different ways you can meditate. A couple of apps that I'd recommend, I'll see if I can pull them up, is there's two apps here. I don't know if you can see them. Let me get my camera. Maybe you can't. Okay, Fertility Strong and Fertility Calm. I think it's probably backwards. I don't know why, because of its like mirrored image. So Fertility Calm is for women. Fertility Strong is for men. I try not to be offended that the strong is for men because I think women are pretty strong. But those are free apps written by fertility psychologists, and they go through a whole bunch of tools in terms of like, tools you can use from like you're sitting at the doctor waiting to get a blood draw to like you're waiting to take a pregnancy test. So all different kinds of tools you can use. The other one I really like is the Calm app. And I'm not sure how familiar you are with the Calm app. The Calm app is amazing. They have some free ones, but I do have a paid subscription to it. And there's a ton of things, where you can do daily different things about being grateful. They have master classes, mental fitness, helps with sleeping. They have all kinds of amazing stories, music, calm music, and there's literally something for everybody in their different lengths. And even if you just like literally as you're drifting off to sleep, listen to somebody sort of talking about opening your, they talk about really calm things. And so I really would recommend that you give it a try. Sometimes it takes some practice to get used to it because a lot of us sort of are running around all the time, maybe not as much these days, but it really takes some practice to try to calm your body and your mind, but it really is important for sort of well-being. And then the last one, what I would say is sort of limiting chemicals. So limiting cleaning chemicals, obviously right now we are using a lot of cleaning chemicals, everybody everywhere. But, trying to limit exposure to strong chemicals. Please continue to disinfect things and keep yourself safe from coronavirus. But in terms of things we don't think about necessarily, so things like cosmetics, I definitely recommend cosmetics that are, try to be as clean as possible. One of the brands that is out there that really is trying to be as healthy as possible and use products that are tested is a company called Beauty Counter. So that is something that I would recommend. Also with shampoos and conditioners, looking for, limited chemicals. A lot of times they'll say, natural and, no parabens and all that stuff. So I certainly would think about, deodorant and, like all the things we put on our body, we absorb those, we ingest those, and not only the foods we eat, but the chemicals in our life that we're using. It's important to, just make sure that we're trying to surround ourselves with as much, cleanness as possible. Obviously, there's always a balance between, avoiding chemicals and then also killing bacteria and viruses and stuff. So you want to make sure that you're also keeping yourself safe from other pathogens besides just the chemicals. And that's pretty much it. Would be happy to answer any questions. Maren will happy to share my social media as well as FCI. I know FCI is on social media a lot, so it'll be important to, just stay connected with us during this time. And I'm happy to ask any questions.
If anyone has any questions, you can post it in the chat.
Oh.
So one of the questions is, what if you cannot know if you are ovulation? What can you do?
Oh yeah, if you not know if you're ovulating. Well, one of the ways you can tell if you're ovulating is if you have regular cycles. That is a way to know if you're ovulating. Also, you can buy the urine ovulation predictor kits like I was talking about. I like the Clear Blue brand. Usually I like the Clear Blue brand that is the not advanced one. So those are some things if you're not sure if you're ovulating. You can certainly call us and we can check a progesterone level in the luteal phase, and that'll prove if you're ovulating or not. It's always good to know if you're trying on your own though, like what you can do to know you're ovulating before you actually ovulate, right? Because you want to know so you can have it time your intercourse appropriately. So usually the nice thing about those ovulation predictor kits is that you can have intercourse the day it turns positive and the day after it turns positive and really have a high chance of making sure eggs and sperm are there together.
So you pair that with timed intercourse. Okay, so it says, going back to exercise, I'm always nervous to do intense workouts after ovulation. Can you speak to that again? Is riding a stationary bike good or no?
I will tell you, when I was going through fertility treatment, I felt the same way. I felt like, obviously when we're doing stimulation to the ovaries and, when we're doing stimulation to the ovaries and there's big swollen ovaries, we don't want them to twist. We don't want them to do really high impact things. When you're not being stimulated though, typically the tube will pick up the egg very quickly, and then everything's happening in the tube. So exercise should be okay. So that should be fine to continue doing exercise. I think stationary bikes should be fine, and they can be intense, but there's, especially if you're staying in the saddle, they're not really a lot of high intense, a lot high, what's that word for, it's just not a lot of bouncing, it's just, impact, high impact. It's high intensity, but not high impact. And so I think that's what a lot of us are wanting, is just exercise that will help make us have cardiovascular endurance, and, and not be detrimental. So things like walking a mild, a moderate level elliptical is fine. A stationary bike, I think, is fine. If you want to avoid high impact things, so like jogging or running or, those kind of things can be really sort of much higher impact. So
Awesome.
Somebody said, let's see, is there a specific time of day you should use the ovulation predictor kits? So there's some controversy about this. Some people say that your first catch urine in the morning is the most concentrated, and so it's the best. And I think that's what most people will do, is your first catch of urine in the morning. Other people will say that most people surge in the afternoon. Like, this was a big controversy when I was a fellow. And so that maybe you should check in the afternoon. I certainly have patients who decide they want to check twice a day, although that can get expensive. So I think that, yeah. So I think that, you can sort of see, you can use a cycle and sort of see whether you can try a cycle where you're checking twice a day and see whether you're able to pick it up in the morning or the afternoon or both. Sometimes people will pick it up both.
The next one says, are there other supplements that are good to improve ovulation that work well when using prenatal supplements? So
obviously, I would encourage you to talk to your doctor about which supplements might be good for your particular situation. A lot of times things like CoQ10 for both men and women can be helpful for egg quality. And then obviously making sure your vitamin D levels are normal, calcium, making sure you're not getting enough calcium. But in terms of sort of egg health or sperm health, CoQ10, is something you can find over the counter. The dosing is 400 for men and 600 for women. There's very little side effects to it. And, but I would certainly check with your doctor to make sure it's a right supplement for you.
Are you more fertile after miscarriage or chemical pregnancy?
Not necessarily, but what I think it tells you is that if you had a biochemical or a miscarriage, it does increase your chances of success, because we know that egg and sperm met up and implanted somewhere. Even if it wasn't successful, it does increase your chances of being successful moving forward. So it's not necessarily that you're more fertile, it's just a sign that you have a higher prognosis than maybe if you weren't to have had a positive before. Hopefully that makes sense.
For how many days should you see a positive OPK?
So, a lot of times you may see that elevated, and it depends on if you're using the advanced version or the regular version. So if you're seeing the advanced, remember, it's going to show you up here. It's going to show you that as soon as this estrogen starts going up, it's going to show you a high before that peak. And so sometimes with the advanced, it gets a little confused on the signals from your body. So I usually recommend not the advanced, which just checks for that LH surge. And most people have an LH surge that can be positive for about 36 hours. So you may have it positive for a day or two. Some patients have conditions like polycystic ovaries or severe fertility, ovarian dysfunction, like diminished ovarian reserve or ovarian failure. And in those situations, the LH may be high for other reasons. And so it's picking up a high LH, and it may show it positive, but it may not be because of ovulation. It may be a false positive. So, most women, who have, let's say you have a 28-day cycle, that surge, you're going to start seeing that surge day 13, and maybe end of day 12, day 13, you'll ovulate around day 14, and then that surge should go away. I certainly have patients who say, I keep checking after the surge and it's still positive, but I think that's just a waste of sort of money, to be honest. So once you see that positive, you don't necessarily have to keep repeating it. You're probably going to ovulate most people will ovulate within 24 to 36 hours of that surge.
I have a question if you can hear us.
Yeah. Hi.
Hey, what's going on? I just don't like typing. So when all this craziness does kind of finish up and you guys open up to everyone for treatments, because we kind of got stopped right at that point where we were ready to order medicine and start the shots. And do you think that when you do open those doors for everyone who are at that point they're ready to start? Because I'm sure a lot of people were in our same position. Is it going to be like crazy backlog where are we going to be able to get in right away and kind of just start off like we finished, or?
Yeah. So that's a great question. So what we're trying to do right now is we're focusing as fast as we can, trying to get everything up and running. One of the things we're doing is we're starting off with patients who have the poorest prognosis, who really waiting 3 months may be detrimental to their ability to get pregnant at all. And we're going to sort of, obviously the door was open, the door had to be shut for health reasons, safety reasons, and now we're sort of slowly going to be opening that door up. We're really having to work on changing a lot of the logistics in the way we do things, in terms of simple stuff like blood draws, how many people are waiting in the waiting rooms, when we're doing like egg retrievals, how the timing of how we're spacing cases, and seeing how many, like, just sort of logistical flow in the office, and trying to minimize, split our office into teams. So if one team gets, infected, we have a different team of people. And obviously our embryology team is really vital, of course, because they're the ones taking care of all the embryos and making sure they're all set up. So, I think that we're working through a lot of those logistics, and also making sure we have supplies. Obviously supplies, both, personal protective equipment, as well as just like supplies. A lot of those supplies come from all over the world, Europe as well as China. And obviously some of the things are hard to get right now from Europe and China. So we don't want to start somebody and then not have supplies to take care of them. So we're working really hard. And my guess is that we're going to be up and running every week. We're going to be reevaluating and trying to open things more and more. We want you to get back to treatment as fast as we possibly can. So obviously all of us are wanting the same thing. We want to make sure we're doing it.
That answers my questions, because I was worried too, because I know is ready to hop back in, but I'm still worried of, okay, I was afraid with everything opening back up that, because everything's opening back up, Fertility Clinic says, hey, go ahead, but like, what precautions, because they're in the back of my mind, is, okay, yeah, COVID doesn't, there's no proof that it hurts pregnancy or anything like that, but at the same time, I just don't want to, with how expensive it is, I don't want to take that chance of us coming back and then her getting sick and that causing an issue that the first trial didn't work. So that was kind of my question too.
So that's a great question. So like, as you mentioned, obviously this is a virus we've only known about for 5 months. So we don't have a ton of data, but the data we do have, and we do have a lot of people who've been pregnant and who've been exposed both in the United States now, as well as our experience in Europe and in Asia. And it does not appear to cause any birth defects like Zika or anything like that. And amazing, we think about viruses like, influenza, the flu, and there's a much higher rate of death during pregnancy for people who get the flu, but that is not the case for COVID. And it's so interesting. The pathophysiology of this new virus is, a lot of the pathophysiology of how it affects you is that it causes an immune response that is like overkill. It causes your body to have this like intense immune response. And then that intense immune response is so intense that your body can't, it's almost like your body attacks itself and can't quite recover. And one of the nice things about pregnancy is that you have a sort of weakened immune system, which sounds bad in a situation of a virus. But actually, women who are pregnant aren't going to have this over-exaggerated immune response because their immune system is a little bit suppressed. So people in pregnancy actually are doing very, very well. Obviously, if you have high fevers, that can be detrimental to a developing fetus, but you can always take things like Tylenol and those things. And certainly there's been some case reports of patients getting delivered early because, they wanted to give treatment to the mother or something, and they delivered them a little bit early. This virus, unfortunately, is not going away, and it's probably not going to go away for several years. And so I think we all need to sort of wrap our heads around the fact that we're going to need to learn how to function with it until there's a vaccine available, which is probably a good 1.5 to 2 years away, as much as lots of people are touting that it might be here sooner. I certainly hope I'm wrong. But what we're doing is we're making sure everyone's wearing masks, both on the clinical side as well as patients. We're really trying to minimize exposure in the office. And we are testing all patients before they do treatment to make sure they're negative. Obviously, you've heard that a lot of patients are walking around asymptomatic, and you know, for that patient, that's fine, but that patient can certainly spread illness to, you know, other patients. It can spread illness to my staff, right? Like, so one of the things we're doing is we're making sure the patients get screened before they start treatment, so that at the time that they're starting the treatment, that, you know, they they don't have the virus, and then we can sort of, you know, if someone is actively infected, then we would wait until they're well.
You should be doing the antibody test, because I'm pretty sure I've already been through this.
Yeah, so it's
Unfortunately, it's
awesome.
not. I know. So the European Society of Reproductive Endocrinology came out with a statement within the week that did say that everyone should have antibody testing. We are working on it. It's not super available here yet. So that's sort of the next step, is to do the antibody testing.
I don't want to steal the show. Sorry, Dr. Rodgers.
no, I love it. I'm so
Glad that I get to talk to somebody. I mean, Marin, I love you too, but it's so nice to get to talk to a person too.
We've been waiting.
patiently.
Thank you.
Oh my gosh, my
Pleasure. All right, good. Well, you know, one of the things that I would say to you all, and I certainly see some familiar names on here, is that I encourage you to be as hopeful as possible. 2020 can still be your best year yet. Obviously, it started in a pretty crappy way, but it doesn't mean that it's not going to end with you being successful from a fertility perspective. There's lots of time left to help you be successful. So, you know, I would use this time as productively as possible, and make sure to keep following us on social media and engaging, and we'll hopefully get your treatment started as soon as we possibly can. And I think it's going to be soon.
Thank you, everyone.
All right. Thanks for having me, and thanks for joining us tonight.